It's online, no. Video. Of course.
Sir, 1 minute more, we can start the webinar. So people will join gradually.
One only.
So, Mr. Ramesh, we can start the webinar because actually time is 8:17 p.m.
Yeah, I think we should start now. Yes.
Yes.
Please.
So officially, yeah, I welcome Dr. and Pal Singh ji, our ji, Ramesh ji, Mr. Shiva Kumar Belappan ji, Sarveshwar Sahu ji, and Senapati ji, and everyone who is present here. So now I would like to Mr. Ramesh for the welcome speech and Sabha update. So Mr. Ramesh Biswal, please.
Thank you, Pravinji. Good evening to everybody.
Good evening.
Good evening.
Let me welcome our guest speaker and also the resident doctor for Indo Eye Care Facilities COVID Treatment and Isolation Center, Dr. Tope Ogonia. And also,
thank you, sir.
Thank you. You are welcome. Also, we are welcoming one of our other guest speaker, in-house guest speaker, Chief Grover. I welcome our mentor groups, Dinesh Rathi ji, Shiva Subramaniam ji, and Anil Gopwani ji. I welcome all SABHA members, president of each Samajams, and amongst them we have available members from so many Samajams, so you are all welcome, sirs. Also, we welcome the members of presidents and members of IPF, ICA, IWA, and other organizations. We also welcome all the participants in this group today. So we are here for our 21st webinar, what SABHA is conducting today, just to have three things. We wanted to have three things today. First, we wanted to inform you all that SABHA, in association of Indo Eye Care Foundation and with the support of all Indian communities and corporate houses and total Indian diaspora, has reopened the Indo Eye Care facility on 13th of this month for the second time to protect ourselves and also the host community members from COVID second wave. From 13th, the hospital is open and the resident doctor himself is here as the guest speaker today. And as of now, we have 5 patients are there. There are host community, there are 2 patients, and from our Indian community, there are 3 patients are there. And for tomorrow also, we are expecting another 3 patients who are coming because COVID is everywhere now. And I just wanted with our condolences. You must be knowing in these recent 2 days, we have lost 3 of our brothers and senior citizens of India's. So they are one of the Pastor Matthew and Mr. Nanduji and one more patient just today evening at Vedics. So the SABHA give its condolences along with all Indian community members for the gentle souls to rest in peace. In future, within a week's time, we will also arrange one Sarvadharma Pratna so that we don't want any more casualties in coming days because COVID is such in a high rate. For that reason, we are requesting our Dr. Tope Oganian to update and how we can protect ourselves. So this is the second objectives. Third objective is also there. We have made this facility available to the host community and to Indian communities with the support of, with the initiative of SABHA and association with Indo Eye Care Foundation and all Indian community and corporate houses. With their supports and contributions, this has come up. So we wanted to again re-thank them because their contributions has made us to make this facility so quickly available for second time. So that one also is one of the agenda to thank everybody. And on behalf of SABHA and on behalf of all Indian communities, we wanted to thank everybody for that contributions. And with this, I welcome one and everybody to listen to our webinars. But before that, I request Pravinji, one of the SABHA coordinator, to update and give the thanks to all the corporates and individuals who have donated for these projects. Pravinji, please.
Thank you, Ramji. Thank you. So, as you know that this project is actually going forward now with the help of the Samajam corporates and supporters. So, with due respect, SABHA Sanyukt Bhartiya Association is expressing the gratitude of for your generous encouragement and financial help, such as donation in cash or kind, to project COVID-19 for the unconditional and undivided support for this project initiated by SABHA in association with Indo Eye Care Foundations. Your enthusiasm reflects your commitments and feelings about how important your support is for the establishment of Isolation Treatment Center Type 2 Project COVID-19 in Lagos. We express our sincere gratitude to His Excellency Sri Abhay Thakur Ji, High Commissioner of India to Nigeria, and his entire officials in Abuja and Lagos office for their moral support, encouragement, and valuable advice toward projects COVID-19. Once again, we are grateful for your generosity, your trust, and your commitment to the project, which will surely help end of coronavirus pandemic from Nigeria, from first wave and second wave to first wave to second wave as well. So the major supporter and for these projects are Tolaram Africa Enterprises Limited, NP Group, Indian Professional Forum, Jhule Lal Sindhi Samaj Charitable Trust Nigeria, Keval Ram Chandrai Foundation, Indian Cultural Association Lagos, Rotary Club of Lagos Island, Far East Mercantile Company Limited, Quantum Packaging Limited, Sumal Food Limited, Tropical General Investment Limited TGI Group, Worldwide Commercial Ventures Limited, Canara Sangha Nigeria, Airtel Nigeria Limited, Mauka Foam Limited, Bhojpuri Parivar Global Foundation, Sane Punjab Association of Nigeria, Mahatma Gandhi Gujarati Culture and Social Association, Hano Marine Products Limited, Phoenix Steels Limited, Saporji Palonji Limited, Oriya Samaj Association of Nigeria, Tamil Association of Nigeria, Flex Films Africa Private Limited, Mikano International Limited, Lagos Banjo Parishad, Rajasthani Samaj of Nigeria, Gift of Life Africa, DAG Industries Limited, Mobile Weil Limited, Rotary Club of Lagos Palm Grove Estate, Bama Wave Foundation, Tulu Kota Lagos, Guru Nanak Satsang Mission, Chi Limited, Pulkit Steels Limited, Jain Samaj, Maharashtra Mandal Resident Association Nigeria, Avanti Industries Limited, Asmis Culture Association of Nigeria, Telugu Association of Nigeria, Indian Women's Association, Blue Ocean Technical Services Limited, Caribbean Night Limited, Cell Plast Limited, Cell Plast Industries Nigeria Limited, Prestige Insurance PLC, Simba Foundation, Indian Culture Association Ibadan, Indian Muslim Association of Nigeria, Kiara Industries Nigeria Limited, Melvin Dixon Nigeria Limited, Pentagon Plastics Limited, Philips Pharmaceuticals Nigeria Limited, Rapa Paints Limited, Sterling and Wilson Nigeria Limited, Flying Dove, Ram Kishan Patluri, Dangote Fertilizers staff members, Geeta Plastic Products Limited, Swar Jatra Artist Association of Nigeria, Kerala Samajam Association of Nigeria, Harmony Musical Society Nigeria, Indian Ayyappa Bhakt Mandal Association, Perfect Packaging Limited, DK and Sons, Mangalore Cricket Club, PSJ Agro Farm Limited, Telenautica Limited, United Cricket Club, Afro-Asian Initiative for Development, Mr. Amajer Singh for Spice Route staff, OK Plastic Industries and individual Mr. Deepak Kalita, Mr. Shanti Gulati, Mr. Boba Bose Babu, Mega Plast Limited, Mr. Rakesh Agarwal, Mr. Ajit Jadhav, and one individual donation without name, and Mr. Ashish Bagadia, he has donated X-ray machine on returnable basis. So these are the supporter, and their encouragement and continuous support is still continue for these projects. So thank you very much, Ramesh ji. So now,
Thank you. Move forward with the further program, please, Praveen ji.
yeah. So now it is time for the webinar, and I would like to request Mr. Pal Singh to control this podium for this webinar and go ahead for the as per the program scheduled. So, Pal Singh, please.
Thank you. Thank you, Parveenji. Good evening, ladies and gentlemen. It's a great pleasure to invite Dr. Agunia today here. He's going to talk about COVID-19. He was a resident doctor in Bagada Clinic for some time, and he treated thousands of patients over there. And then during first opening of Indo Eye Care, he was a resident doctor in Indo Eye Care, treated several patients successfully. And now also he's a resident doctor in Indo Eye Care and treating patients successfully. He's going to talk about COVID-19 now. He will tell us what COVID-19 is all about and how we can protect, how we can keep ourselves safe, and how we can treat when needed. If you have any question, please feel free to ask question when there's a time for question and answers. So without wasting much of time, I would like to invite Dr. Agunia now. Dr. Agunia, welcome.
Yes, sir. Good evening, everyone.
Good evening.
Coordinators, the moderator,
Yes.
the Indian community, we appreciate this privilege to give a short talk on this second wave of COVID-19. And the whole essence is also to ensure that we are able to protect ourselves and we remain in good health at the end of it all. Okay, so I would like to start by just mentioning again that COVID-19, which started was first discovered in China in the late 2019, around December, but became a very serious worldwide issue by January 2020. It's a virus, it's caused by a virus. And since that time to now, it has spread globally. And so it has become a pandemic. Now, we know there was a first wave in the early 2020, subsided towards the end of 2020, but has now resurfaced, and now there's a second wave. And this second wave is not just peculiar to Nigeria, but globally. Now, I want to mention just a few things before I talk about what we need to do or how we need to protect ourselves and the information that is relevant to ensure that we survive, we're in good health, we remain in well-being, and then we can maximize our productivity and everything about us during the second wave. Now, the difference between this second wave is that this second wave has been found to be more virulent, spreads faster than the virus in the first wave. The mortality is higher, and the morbidity and the level of illness it causes is also found to be worse and more in this second wave. And so I remember you mentioning about some people who had fallen and unfortunately lost their life as a result of this second wave. The same thing has been occurring even among nationals in Nigeria. And so even at the IDH, which is the main isolation center for COVID-19 in Lagos, the mortality itself, even among nationals, has been quite high. I would use the word very high. We've lost quite a number of people at a very short time compared to the first wave, where the lives lost was spread over months. But this over a month or two, we've lost quite a number of people. And that therefore this calls that we need to take extreme precaution individually and even as families, so that we do not fall to the ills of this virus and this disease. Okay, so the main thing to bring out here is how do we protect ourselves, which is the essence now. Before I go on, I would say that presently there's still no drug that cures COVID. So research is ongoing worldwide to find out which drug can be used to actually cure it. But presently no drug has been found or approved as the cure for COVID. COVID-19. Then also, as regards the vaccine, vaccines are, yes, are being distributed worldwide, but we also need to know that despite the fact it's still distributed, research is still ongoing, and then the vaccine has still been found not to 100% prevent the disease. The best it does is still to minimize the severity of the disease. So while some might be fortunate to have the viral vaccine prevent the disease in them, the major advantage of this vaccine is that it helps to reduce the severity of the disease. So the best thing at this particular stage is still prevention and taking precautions to ensure that we are not exposed or the disease, the virus, doesn't enter into our bodies. Now, we also want to remember that it is majorly a respiratory illness, a respiratory virus. There's the issue of contact, but even as regards the contact, it still boils down to we touching or airborne. We know it is majorly droplets, but there are also arguments and facts, some facts, which is still being trying to be proven that there's some element of it being airborne. Now, this is relevant so as to know how we can protect and prevent the disease in our families, in our communities, and even amongst ourselves. Now, so what do we need to know before I talk about represent? The most important thing here, as I said, the mortality and the morbidity and the transmission or the spread has been faster, has been worse, and has been greater in this particular second wave. And the second wave is still increasing, it's not decreasing. So based on the postulations, people are expecting that it will keep increasing for now. We are hoping to flatten it, but it's still increasing for now. Now, there are a particular set of people that are majorly at risk. Now, everyone is prone to the disease because it's respiratory. So as long as we breathe in air, everyone is prone to COVID-19. But those who are majorly at risk of increased morbidity, increased severity of the illness, mortality, are those, one, from observations and what we've seen even in IDH, that's the infectious disease hospital in Yaba, and even in other hospitals like Lut and Lasut, most people who have underlying illness are the major people with the greater severity presently, underlying illness, especially diabetes and obesity. Diabetes and obesity, those are the people who have been found to suffer the most from the consequences of COVID-19. Inclusive is hypertension. Hypertension is also found to be a major contributor, a major risk for increased morbidity and mortality. But I would like to mention again that it has not been diabetes, diabetes and obesity have been found to be more important risk factors. Another risk factor is old age. So the older, especially advancing age, they are more at risk. But one thing I want to say about this second wave, we have actually lost people at the IDH, people who are even in their early 30s and 40s. But old age is still a risk factor. People who are 50s, 60s and above. Why? Because the body is aging and is not strong enough as a younger body to fight any illness. So old age, advancing age is still a risk factor. Another risk factor also is people who have compromised lungs. So what are these people? These are people who have probably have had history of smoking or maybe smoking or have heavy alcohol congestion. Why this is relevant is quite a number of the CT scans that have been done or chest x-rays that have been done for people in that before or after, prior to doing their COVID-19 PCR test, there's a lot of infiltrates and significant abnormalities seen in their chest films. And so the higher the abnormalities in the chest film, the higher their likelihood of not making it. And we know that smoking and heavy alcohol ingestion ultimately affects the lungs. So people who have been exposed to heavy smoking generally, or heavy alcohol intake at this particular time, they could be at higher risk of having higher morbidity, higher mortality, or severe illness of COVID-19. I also talk about how we need to how we can address that during the prevention. So now what we need to do to protect ourselves is still the same preventive measures that were employed in the first wave. One is respiratory. So the most important thing at this particular is covering the nose. And so that's why the use of the face mask is completely and utmostly important. Using a face mask, which could be the medical face mask or the cloth face mask, helps to cover the nose. And so even if the virus is around, it helps to either reduce or prevent the virus entry. And studies have shown that the less the load that goes in, the less likely that the severity of the disease or even so the use of the face mask consistently at all times when we are around people is still the ultimate and the utmost means of preventing and protecting ourselves. Now, another very important one is avoiding crowds or overcrowding. Now, it's important. It's either if we don't have to be in a place where people are jam-packed or overcrowded, we need to avoid such a place. If we don't have to be there, then we need to avoid. We need to be exempt ourselves, take an excuse not to be there. Especially, I said, people who might have this high risk, but even everyone generally. If you don't have to be in a place where there's a crowd, please, if you can excuse yourself, that is one of the best things, excuse yourself. If you have to be in a place, because we know that there's no lockdown, economy has to move, economics and businesses, schools, they need to operate. We can't really shut down our lives completely unless it's completely important. So I know there are periods when we may have to be in places whereby we have quite a number of people around, or we have quite a number of people in that room or in that particular environment. If we have to be there, one, we need to use the face mask. We need to encourage other people in that place, if it's within our power, to use this face mask. And we need to ensure that we employ physical distancing. So in our workplaces, in our schools, in our companies, we try to separate, give a distance of 1 to 2 meters between people as much as possible. It's also encouraged that if we can practice open ventilation, it is much better preferred to using the AC, using a closed environment. So using open ventilation if we have to be in a room, and if possible, it's encouraged that if we can use it in the open space, in the outside, for some situations, maybe we have to have drinks and these gatherings cannot be cancelled, we can use the open space. That is even better because with the physical distancing, with the mask and the open space, that helps to prevent the disease, the virus spreading faster or effectively. That is very important. So the face mask, avoid overcrowding, avoiding crowds, and if we have to be in a crowd, physical distancing, 1 to 2 meters, and then open ventilation, preferably avoid the open ventilation as much as possible, and then if possible, open space for some situations, for gatherings, some events, preferably. And then, also very important, is the use we talked about. It can also be spread through contact. Contacts where we touch contaminated surfaces. And so we need to practice, especially in our offices, in our schools, in our various meeting places, adequate sanitizing of surfaces. The simple hand sanitizers, surface sanitizers need to be there, and they are wiped regularly. Preferably before the meeting or before the gathering, and after the gathering might just be enough. If at least that. So after the gathering, we wipe the surface with the surface sanitizers or chlorine-based preparations, wipe surfaces before meetings and after meetings. Surfaces, when we do that, it helps to kill the virus because the chlorine has been very effective in killing the viruses. It's also encouraged that in such our meeting places, we have spots whereby people can sanitize their hands regularly. Of course, we encourage everyone having his or own hand sanitizer, but it's also important and to also go a long way if meeting places, schools, venues have sanitizers stationed or hand washing spots stationed at various places whereby people can wash their hands or sanitize their hands regularly. So that if they have had, if they mistakenly touched a surface that is contaminated, the process of washing the hands can help too. And using sanitizer can help to sanitize and kill the virus. Then also of importance, I'll say yes, another way of preventing now, I talk about, I'm going to the people who are at risk. So for people who might have diabetes, and this, as I said, has been found to be very important in this second wave, people who have the risk factors, how can they protect themselves? So if one is diabetes, he has diabetes, it's very important that such a person is using his medication adequately. This is a period that if the person must not miss his medication, skip his medication, this period the person must use his medication judiciously, religiously. And also, as much as possible, monitor his blood sugar. So if the person can get a glucometer, it's preferable. If not, find a means of at least weekly checking to see that the blood sugar remains within normal. It's been found out that people that have COVID, it's been observed that people that have COVID, when they have COVID and they have diabetes, their blood glucose somehow starts to get deranged. So it's very essential that they monitor. One, they use their drugs as they should, and then they find time to monitor either 2 or 3 times a week, or at least once a week. And immediately they notice there's any change, they need to see their doctor, either contacting by calls or social through maybe Zoom meetings, or if physical, if where possible, inform their doctor so that doctor can make necessary adjustments. Same thing for people who are obese. What we have to encourage is that, for people who are obese, basically they have to ensure that the various precautionary measures of face mask, avoiding crowds, they need to follow it strictly. As I said, when they have COVID, there's a possibility that they might come down with the severe disease. And it's explainable because people who are obese or very big, their hearts and their lungs already most times are working under some form of pressure. So with the COVID, the pressure increases because it affects the lungs. So they have to work more. And sometimes their body might not be able to stand that pressure or be able to provide adequate oxygen for themselves. Then people who are hypertensive too, they need to make sure that they are using their medication adequately and also monitor their blood pressure. Very important at this time. When they see any change or derangement, quickly alert their doctor so that changes can be made, either to increase the drug, change the drug, so that there can be better control. Because when there's better control of the glucose, blood glucose and hypertension, they are not likely to fall into the severe stage of the disease, even if they have the disease. Smoking, I would say at this time, smoking is preferably best stopped. For people who are still maybe trying to cope or find a way around their smoking, they need to stop it at this time. That is the best advice now. Because I said CT scans show that there's high infiltration, high deformities, a large amount of deformity, and the higher the percentage or extent of the damage in the lungs, the less likely such a person will be able to oxygenate, and then we have issues with breathing. Then alcohol intake also needs to be reduced at this particular time. Now, so there are some drugs that and lifestyle modifications also that everyone generally needs to apply at this particular time. No drugs, I said, can cure COVID yet. The vaccine, we are still expecting. Yes, one or two people might. I know there are so much effort to try and bring it around, but like I said, it's still something also that came out within a very short time. Just didn't follow the normal long period of research. So the effectiveness and the efficiency, yes, we cannot say 100% yet, but we know there's a high level. At this stage now, we need to improve our immunity. Immunity, in this case, the more the body is strong, the stronger the immunity of the body, the likelihood, the higher, the better the body can fight the viruses. Viruses normally affect immunity of bodies generally. Same thing, COVID. So the better at this stage, we need to improve our immunity. How do we do that? Number one, vitamin C, 1,000 milligrams daily, at least, is what everyone can take. It has no major or relatively no side effects when you are taking 1,000 milligrams, or for some people even 2,000 milligrams daily. So it's something that you can take and it's safe, and it can be taken every day. While throughout this COVID period, it's safe. It can be done on a daily basis every month. Vitamin C, 1,000 milligrams daily. Vitamin D, vitamin D3 in particular, has been found also from research at this particular period that it helps also to increase the immunity and help the lungs. So it's also is a recommended medication also, supplement that people can take at this particular period. Vitamin D3, 1 capsule daily is okay. And it helps to improve the immunity and also the work and the functioning of the lungs. Zinc also has been found. It was since the first wave and still in the second wave, is still very effective. Zinc usually comes in 100 milligrams tablets, 1 tablet daily. It can be taken daily with minimal to no side effects, and it can be taken as a long-term medication. Then there are vitamins, multivitamins. So multivitamins also either coming in capsules in their various brands. Any good brand can be used also, in addition to the vitamin C, the vitamin D3, and the zinc. Multivitamins, capsules, 1 daily. The multivitamins have some other like selenium, manganese, which also in one way or another contribute to the immunity. So also if we have the opportunity of getting multivitamins, 1 capsule daily can be added. In addition, it's been found, I said, the stronger the body, the possibility of fighting it, of not being symptomatic, of remaining asymptomatic, or having just a mild form of the disease. So eating well to at this particular point is very important. Eating nutritious food is very important. Drinking adequate water is very important. Water helps. It's very important at this particular time. Then resting well. Resting well, because it helps the body to be strong, it helps the body to be healthy, and helps us to fight the virus. Now, the question comes in, if I come down, so that's very important. Now, the question comes, what if someone comes down with the virus? If the person is sick, if the person has done the test and is found out to be positive. Now, if the person is positive or is asymptomatic, has no symptom, that is the best stage anyone wishes to be if the person comes out with it. So if that happens, using the multivitamins, the vitamins, and lifestyle modification is most times enough to take care of the disease. And with time, the person will remain without symptoms. Of course, as such, the person needs to ensure that if this is symptom, since he has a virus, he can spread it, but he may not show symptoms. So he needs to, as much as possible, he has to self-isolate. And if he has to be around people, maintain that physical distance and use the mask, but self-isolate. Now, if the person has the virus, has the disease rather, and has some form of sickness, any symptom. Now, there are some symptoms. Now, there are various symptoms that have been associated with COVID, from respiratory, such as runny nose, catarrh, cough, some chest pain. Some people have talked about even vomiting, diarrhea, headache, fever. If it is mild, it's still the same thing. You should use the medication, use supplements, inform his or her doctor. If it's mild, it's not an indication to be admitted. Inform his or her doctor, and they can prescribe drugs to address a particular condition. That's so the doctor will have assessed and see if it is severe, if it's mild to severe, fever, mild fever, catarrh, maybe some just some mild weakness of the body. Mild, possible to just isolate at home, treat the symptoms. Doctor prescribed to treat the symptoms, continue the medication is used if he has underlying condition, and rest. But what you need to watch out for that will require admission and what we should not consider irrelevant or trivial are if there's severe body weakness. Anyone who is very weak, gets so tired, unable to move, unable to perform activities, that person needs to, and it's positive, that person is advised to go to the hospital, because there's a possibility that he may already be having low oxygen saturation, and that might be causing the severe weakness of the body. Somebody who is having severe cough is also advised to go to the hospital, because the severe cough most probably might proceed to difficulty with breathing, and then difficulty with breathing. That has been the major presentation, major morbidity in this particular second wave, and the most people who have died, their major presentation has been difficulty with breathing. So if there's difficulty with breathing, it's something to go inform the doctor and go to the isolation center on time. Severe cough, go to the isolation center on time. Generalized body weakness, get so tired, severe weakness or tiredness, it needs to go to the hospital. That I'll say, if we practice those measures, then I can say we protect ourselves, we are not likely to have any negative outcomes. I think with this, I consider this is what is the information I think we need to know at this particular time as regards this second wave of COVID. And if we apply them, we are very, very likely to come out with good outcomes. One, not falling ill, not getting the virus, and even if someone gets the virus, the person be able to survive it and have a good outcome. Thank you.
Wow. Thank you, Dr. Gunia. Thank you so much for this wonderful presentation. This is really going to help all of us. And I request all the participants here to really take very good care and make note of all what Dr. Gunia said. He's having a very good experience in COVID treatment, and he is the resident doctor presently in Indo Eye Care. So all the patients who are presently there or are going to be there will be in his care. And as you can see, the experience or the speech, you can feel that the amount of experience he's carrying. We are going to be in the safe hand, and let's pray that everything goes well. Dr. Gunia, we still request you to please remain standby, because now we have another speaker coming up, and after that there'll be some question and answers. So please help us to stay for a few minutes on standby, and then we will be hearing your input again.
Thank you, sir.
Yes. Thank you. Thank you. So our next speaker is now is very well known to all of us. He has done several webinars successfully and saved so many lives here. And he is none other than Chief Grover, Anil Grover. He is the chairman and managing director of Grover Clinic. He's very well known to all of us. Dr. Grover, Mr. Grover, can you please come forward and make your presentation on COVID-19 treatment now?
Thank you, Shripal Singh ji.
Thank you, sir.
Dr. Tope, good evening to you. Thank you very much for your wonderful update. You have enlightened us today on the recent developments and recent positions, what is happening in COVID second wave. Most of the points Dr. Tope Ogunian has already covered. So I'll try to touch some of the important points to refresher us. It is truly a sad day today that we are making this medical presentation where we lost two Indian citizens yesterday and one Indian citizen just died in the evening before we started this medical webinar. It is very, very, very heart touching that this COVID second wave is truly real and deadly. Ladies and gentlemen, uh, some of you who have attended the medical webinars in the past also, I will try to touch some of those important points which can be helpful to spread the message in your community, in your company, in your colleagues, with your friends. To start the presentation, let me highlight one point which was already mentioned by Dr. Tope Ogunian also. This COVID-19, the latest version, this coronavirus has already mutated. This latest strain which has come into Nigeria has changed the genomic RNA shape and size and the spikes. These spikes are highly, highly deadly because this new coronavirus penetrates into our body, into our body fluids very fast. Penetration is very fast. And once this coronavirus, this deadly coronavirus enters your body, look at the screen where I'm trying to show the pathogenesis, how the medical manifestation happen. It enters through our nose, it enters through our mouth. That is why everybody is saying, please cover your nose, cover your mouth. And through your nose and mouth, this coronavirus enters our respiratory system. Once it enters the respiratory system, it attaches with the host cells. And once it attaches the host cells starts bursting and dying. And that is where the inflammatory response starts from the lungs, from bronchial parenchyma, from our throat, and it starts spreading into various organs one by one. And it leads into multiple organ failure, respiratory failure, and eventually leads to death. There is a difference there is a slight difference into the clinical presentation of the last year first wave and the new second COVID-19 wave this year. There is a difference in terms of symptomatic presentation. Last year, when the patients were coming to the clinics and hospitals, most of the patients were having primarily high-grade fever, cough, and some of the patients, actually, they were reporting at the advanced stage shortening of breath. But now, this time around, since last 5 or 6 weeks, we have seen so many cases when they come to IDH, when they come to hospitals, they are coming with a new presentation. Loose, watery stools, diarrhea, viral diarrhea, vomiting, chills, severe sore throat pain. Patients are complaining with myalgia, joint pains. So please notice these symptoms. When something is happening in your body, raise the alarm. There is a D. In next 2-3 minutes, I would like to speak D. D means danger. And that is why now doctors all over the world are cautioning each and everybody here in our society. I want to talk about 5 Ds today. Any one of you who is listening, listen carefully, these 5 Ds. There is a lot of disconnect, number one. People are trying to shy away from reality. They are aware, but they are trying to ignore the awareness. They are aware what to do as a preventive. We have more than 33 million WhatsApp doctors all over the world. Every day we receive awareness campaigns, what to do, how to prevent, what are precautions to take. But how many are taking? So there is a disconnect. People don't want to believe that this virus will catch me. There is a disconnect and there is a disbelief. Point number 2, there is a discomfort. D, there is the early signs and symptoms which body gives to you. Ladies and gentlemen, do not ignore those symptoms. There is a difference, I will highlight in my next slide, from common viral flu to the COVID-19 flu. That those body discomforts are easily visible in first 3 to 4 days. Guys, do not ignore those early signing warnings. Number 3, denial. I've seen n number of patients in last 6-7 months. When you tell them on the 3rd or 4th day, sir, please, can you go to Luth? Can you go to Yaba? Or can you go to any private lab and do the swab PCR test? Do you know what is the answer? No. It cannot catch me. This is not my portion. It's very common. Denial. People deny that somebody can get infected with COVID-19 or coronavirus. Why? Why to refuse to go to see a doctor? Why do you want to see that? No, it cannot catch me. It's real, ladies and gentlemen. Do not deny. It is real. Please do not refuse the advice to go to the doctor. Family members, I don't want to name again. Yesterday, what happened? We lost a very good religious gentleman. Last week, his family members, his wife, his son told that gentleman, can you go nearby in Lekki and visit that hospital and see the doctor? He said, no, nothing is wrong. It's just a mild cold. I'll be fine. Do not deny. 4th D, delay. After the denial and refusal, you know what happens? 7 out of 10 patients, they start self-medication. They start self-medication at home without doing any test, without seeing a doctor. So the delay from 3rd, 4th day, they end up reaching 9th, 10th day. When actually now it aggravates and virus load increases, inflammatory barrier response increases, patient enters into the IL-6 leukotriene storm, and when actually the lungs are already compromised and fibrotic changes are happening, and patient actually when reaches ARDS, acute respiratory distress syndrome, then actually they get out of their bed and then they go to the doctor. So delay. My appeal to all of you friends is, from day 3 to day 8 or day 9, do not deny, do not delay. If you don't want to die, read your body is giving you signals, advise, listen to your doctors, go to the hospital, start the testing, start the investigations if you do not want to reach stage 5, which is death. When yesterday, what happened in both the cases? Early in the morning, what happened yesterday with Reverend Father, and late in the evening yesterday, what happened? The complications already reached where vital organs, lungs, heart, kidney had already been affected and compromised. So at that stage, when you are coming to the doctor or a hospital, there is hardly 10% of the chance for the doctor to do a miracle for you. Do not remain disconnected. Read the early signs of discomfort. Please do not deny. And humble appeal, guys, ladies and gentlemen, do not delay now. In this time, COVID-19 second wave is real here, and it is much more transmission, the community transmission. The transmission is very fast. I want to make an appeal to all of you, whosoever is listening. Tell your friends, tell your family, tell your colleagues not to ignore, please. Danger is real. Dr. Tope Ogonian has already highlighted what is the best and easiest and cheapest way to prevent this infection. Mask, mask, mask. If you can see in my screen, if you cover your mask, nose and mouth, if you cover your eyes with face shield, if you cover your head with any kind of a simple cloth headgear, the chances of transmission of this infection will reduce to barely 1% or 1.5%. That important is the role of mask. There was a small survey done by Business Day last month among the common public in Nigeria. Five out of 10 Nigerians on the road, first of all, they said there is no corona, there is no COVID here. And then it was found 7 out of 10 people in the common public, when they are on the bus, in the supermarket, they do not believe in wearing mask. This is very, very strange. Let's advise everybody. Everybody knows it, importance of mask. But when you go to a restaurant, when you go to a supermarket, when you go to a bus, or when you go to a club, people are doing parties, socializing without mask, hugging without mask. Common cold, common viral flu, fever is very mild. I want to differentiate here for the people to understand what is the difference in terms of clinical presentation. But in COVID, fever is high-grade fever. Sore throat or sneezing is common in common cold flu, which automatically goes away in next 3-4 days. But by 3rd or 4th day, if your sore throat, if your running nose starts coming with very irritating dry cough, this is a signal to you guys that virus has gone down in the lower respiratory tract in your lungs. And the next warning is, patient start complaining of shortening of breath. Slightly you walk, even you bath, climb the stairs, your body is breathless, weak. So these are enough signs. And even if you, particularly in the second wave, the GI tract is also invaded by this new corona version. So a lot of patients are complaining with viral, loose, watery diarrhea. These are enough signs for you to understand that you might be affected with COVID. There's nothing wrong. Once upon a time, 33% population of the world will be affected in next 2 years. Nothing wrong. But treatment should start at the earliest possible if you don't want to go to the danger signal. Dr. Tope has also highlighted already who are the high risk people. Smokers are at high risk people. Chronic disease like people, diabetes and hypertension, COPD, old history of asthma, any kind of cancer history in the past, these are high risk patients. Elderly people, they are high risk patients. Health workers, they are high risk patients. So please protect them. The biggest advice which I want to give here is smokers, please quit smoking or reduce smoking at this stage because it will compromise your lungs in a very big way. So we have already discussed third or fourth day. If the symptoms persist, do not wait. Go to the doctor. Go to any public hospitals if you cannot afford, or visit your family physician or private hospitals for earliest possible investigations, testing. These days, fortunately, there are a lot of labs where swab PCR can be done. Results are available within 24 hours now. In private labs, the charges are only 50,500 naira. In public hospitals, it is free. Now, way forward. In terms of way forward or treatment, my first advice is please do not do self-medications. We saw recently a couple of cases, those who were doing self-medication of hydroxychloroquine in the house, which was actually, it is of hardly any help, but leading to cardiovascular disorders. Please do not take chloroquine or hydroxychloroquine at home without the advice of a doctor. On the other hand side, in last 9 months, there is a very good clinical experience. Worldwide data and science has proved that good antiretroviral drugs are available. Good clinical studies are available where some of the drugs with combination of ivermectin, azithromycin combinations are available to treat the symptomatic management of COVID cases. Vaccine is still not yet available, guys. It might take another 2 months by the time it is available for the open public in Nigeria. So till that time, please take all the precautions seriously. For critically ill patients in ICU or advanced stage patients, there's a wonderful treatment available. Some of the hospitals in Nigeria also, they want to do the clinical trials, especially in Luth, they want to try the human blood plasma transfusion therapy, which is helpful in advanced stage, in ICU critical stage. Results wherever, in whichever countries they have done, Singapore, India, Dubai, Australia, some of the good studies are available even in South Korea and Japan. Plasma transfusion therapy has been found helpful. Now the question is, how many people in Nigeria will come forward to donate their plasma, those who have recovered, and how many people in Nigeria will accept the plasma transfusion? That's a big question mark here. In terms of treatment, and very nice, cheapest available option is steam inhalation. Lungs are compromised in COVID patients. There's a lot of bronchial secretions which cause cough and which reduces the, due to the fibrosis of the lungs capacity, oxygen intake capacity is reduced. So steam inhalation 2-3 times in a day with hot steam will try, because the viruses which are attached in the nasal parenchyma, nasal and throat cavity can be helpful. Please encourage steam inhalations. And I've already said hot water, salt water gargles, hot water gargles will help, especially in the people who are smokers. Role of immunity is very important in COVID. Those people who have high immunity, a good T cells in the body, it has been found that coronavirus affects them in a very mild way. That is why their symptoms are very mild. Their viral load is very mild. But those people who have a good boost immunity, strong immunity, they are very healthy. chances of COVID attacking to your body is low if your immunity is strong. And there are a couple of remedies available nowadays in Ayurveda also, herbal remedies also, in allopathic clinical medicine also. There are plenty of things which are available these days to boost your immunity. Ayurvedic Kada is available. The fruits and vegetables which are high in pH content, zinc, they are available. Turmeric powder along with the honey and garlic has a high immunity booster. So these are the things which you can take as a prophylaxis as well as during the treatment to take care of your COVID treatment. Couple of things, recommendations here, which are rich in zinc, which are rich in vitamin C, oranges, pineapple, fruits like watermelon, green leafy vegetables, ginger, garlic, turmeric, honey, and avocado. Avocado is which is very freely available in Africa and is not expensive. So some of these things are very, very helpful to boost your immunity as well as during the line of treatment also. These fruits and vegetables to boost your immune system and help you in the treatment, they are available. Final recommendation, guys, ladies and gentlemen, please do not do self-medications at home, especially anti-malarials and antibiotic without the advice of doctors. Please do not take them. They won't help you, rather they will harm you with a lot of side effects. There are plenty of isolation centers are available where the person can be treated, can be admitted. IDH Yaba is there, Luth Isolation Center is there, and now our Indo Eye Care Isolation Center in Ajawa State, where Dr. Tope Ogunian is the team leader. He is the head consultant. He has a team of doctors there in Indo Eye Care Isolation Center. Please give the message, spread the message in your community. If anybody is found positive, it is not a death sentence. Get yourself admitted in isolation center. Do not put other people in the community at risk by treating at home. You are risking most of the other people in your compound, on your building. Let's not do that. Let's be responsible. Declare yourself if you are positive. Go to the isolation center. Treat there. Treatment is available if you go there early. Within just 12 days or 2 weeks, you will be fine. Okay? Second wave is real. It is happening here all over West Africa. Unfortunately, it is very sad that more and more Indians, a lot of Indian community people are getting affected in plenty of buildings where Indian community people are living. They are falling sick. More than 80 to 85 people are currently positive in various residential buildings. So do not hide at home. And there's nothing to fear. Declare yourself, go to the hospital, get yourself tested. And if you are found positive, go to our isolation centers and get yourself treated. Thank you very much. Over to you, Pal Singh ji and Biswal ji.
Thank you, Chief Grover ji. As usual, it has an excellent presentations. I calmly hearing, but I'm sure even if you are having less participations, everybody must have noted down. I am sure it will be circulated amongst all so that everybody will get benefits. Chief Grover always is going that 24/7 service dedicated to the Indian community. Thank you, Chief Grover.
Sir, I
And now
forgot to
also-
mention one thing, that our ambulance services are also available if anybody needs any help.
Yeah. And also for all everybody's knowledge, Chief Grover is sponsoring all running and maintenance expenses of the ambulance services like medical services. And also he himself dedicated for the Indian community. Thank you, Chief.
Thank you, Chief Grover. Thank you so much for the wonderful presentation. Thank you. So I think now this is the time to question and answers. I think is Rameshi, is it the time for question and answers now?
Yeah, please, sir.
Okay, okay. So it's free now. If anybody want to ask any question, please come forward and ask question. Dr. Gunia and Chief Grover both are available to answer your questions, please. Chief Grover, I have one question.
Sir, unmute yourself. Unmute, please.
Oh, sorry. Chief Grover, thank you so much for the wonderful presentation. It's really going to help everyone here. This is the time now to ask questions. So it's free. Everybody can ask question. And I want to start with my question. Chief Grover, some people are asking me that is it safe to use swimming pool nowadays, public swimming pools?
No, it is not safe.
Okay. Great. Please feel free.
Dr. Palsingh, one question from YY Singh, HSS. He is writing, Namaskar to all. Just a basic question want to ask. Is it confirmed that the virus comes starting from China? Is it confirmed not made by human? It is from snakes or bat? Thank you.
Yes, this virus is not a human-made virus, or it is not a biological virus which was developed in the lab. This virus actually started, most of the even SARS virus, which happened almost 15-16 years back, which started from camel. So this time, this virus SARS-CoV-2 started from bats and from pets, and from pets and bats it was transmitted to human transmissions, and from human transmission it started spreading. The origin was in China. Yes.
Okay.
Thank you, Chief Grover. Thank you. Appreciate.
So the house is open. Participants are requested to just unmute yourself, and any questions you have in your mind, you can ask now, because the time is flying like a bird, and we are going to close the session at exactly 9:40. So we have only 13-minute time to speak our questions and get your appropriate answer from the panelists. So please don't be hesitate and ask the questions freely.
Okay, Dr. Gunia, there's one question. There's one question here on the chat. Good evening, one and all. How much is the possibility of having re-COVID infection? The question is asked by Madam Priya.
Okay, thank you. The possibility of having a reinfection has been established. Quite a number of people have had COVID during the first wave, and they are now having it in the second wave.
Yes.
But what research has shown that there's some form of immunity after the first, if there's a previous infection, and that has been taken like 3 to 6 months.
Okay.
Now, the only thing which I think is still ongoing is there's a possibility that the reinfection might not be as severe as the first one.
Okay.
So that is a likelihood. But as I said, because we are still researching and finding out more about the disease, prevention is still better, even if someone has had a COVID before. And one thing I can say, even from our experience at the IDH and the isolation centers, we have had people who are reinfected. They were infected in the first wave, and they've come back second wave reinfected. So there's a possibility. It's actually happening.
Thank you. Thank you, Dr. Gunia. Yes.
My question is there. Myself, I'm Sabir here. You know, 2020, in the month of May, June, we had a lot of isolation centers. But right now, it is most of the government isolation centers has been closed down. Cases are coming more than last year, the last time. So is there any plan of landmark isolation center and Onikan to be opened? That is one. And even the Nigerian, our colleagues and all that, they still feel their immunity system is very good and they don't believe. But we believe that they may be asymptomatic and they can still pass. So there should be a compulsion that every the Nigerians should be wearing a mask to prevent themselves and the others also. Okay. So these are my questions. Is there a new isolation center to open?
Okay.
So I think
We had many isolation centers, but towards the end of the first wave, a large building was dedicated for COVID, and that takes up to 100+ patients. So actually, during the second wave, when we started, like some weeks ago, that particular building in IDH became fully operational and was taking in patients. But as we've said, and even Dr. Grover said, because we now found out that initially we didn't know about the new variant in Nigeria, but now it's already established that that new variant, which is more virulent, is Nigeria. So we've had cases now about spilling. And so even the whole of IDH now has been dedicated to COVID cases. But irrespective, now we still have more people coming down with the infection and even coming down with the disease. And that's why Ajao Estate has been opened. And as I'm aware, though I cannot say I'm aware the government is making efforts to open some other isolation centers. They are watching the situation, and I know that very soon one or two other isolations might be opened. But basically, the whole of IDH now has been dedicated to COVID treatment. And then we have Lut and we have Lasut. That's so probably along the way, more isolation might be opened.
But these three isolation centers are capable enough to handle the cases.
Yes.
I mean, I'm talking about third stage, fourth stage. Are they capable of handling?
Yes, based on the cases now. But the government, there's these regular meetings are holding to assess the number and the prevalence. So with more cases, more isolation centers are going to be open. And of course, considering the fact that they are need for resources. So that's a bit challenging, but the government is doing all its best to get adequate resources to ensure that the other isolation centers can function perfectly. Remembering that these particular cases that we're seeing now normally come down with respiratory issues, which was not a common feature, very common feature in the first wave. So those resources have to be put in place to ensure that every isolation that is opened is able to handle these breathing difficulties. Then the issue of Nigerians, yes, Nigerians somehow they believe that there's some form of immunity, but the government is trying to educate people that irrespective of a bit of immunity or what they have developed, maybe as a result of exposure in the tropics, they still need to protect themselves. So the government is trying their best to keep educating and enforce as much as possible so that Nigerians don't come down with the disease. It's a tough one, but the government is doing its best and keeps coming out with new measures to try and address the issue.
Okay. Thank you so much. Thanks for the detailed explanation. Thank you so much. One last suggestion, as you are so close to the government and Chief Grover also, can the new isolation center, Indo Eye Care, presently is an isolation and treatment center. Can it be, can we have a ICU room also there with the government permission? So that the last stage, there's no need of shifting patients to different hospitals.
Okay. I think I'll answer then probably Dr. Grover to my mention or two things. So presently, the expertise needed to do to handle ICU cases is a major issue presently.
Yes.
Not just in Lagos, but all over Nigeria. But more staff are being recruited and the necessary equipment gotten. But one of the issues is the staff being able to handle the ICU cases that come up with COVID, because as we have said, their presentation is quite different from the regular respiratory infections. But I know that they are planning to extend, not just in IDH, other ICUs in various centers in Lagos.
There is a
Okay.
serious
No, no.
shortage of intensivists. There is a serious shortage of critical care physicians who are trained to manage ICU and ventilation cases. There is a staff shortage, and then there is another technical manpower to manage those ventilators, to repair those ventilators, to maintain and service those equipments if there is a breakdown. There is a shortage of biomedical engineers also here in Nigeria. So both are the technical challenges there and manpower challenges there. And you need a complete set of a different, if you want to have a ICU in Indo-Eye care, we need to have a complete different ball game together.
Okay. Okay. Thank you so much. Thank you, Dr. Gunia. Thank you, Chief Bro. Thanks a lot for the explanation. Thanks a lot. It will be.
I just want to add one thing. In IDH Yaba, okay, they were having some issues with the ventilator. Is it being sorted out, or is there anything to be done over there in IDH Yaba?
Yes, the government is doing something about that. I think they've tried to do some servicing, and they have 1 or 2 biomedical engineers. And so I know they are working, and there have been some improvement over a few days. They've gotten some more hands to support the major intensivists. So I know work is going on, and I know that with time, as the government addresses these challenges, they'll make the information known to the public and the relevant stakeholders so that people can access and use this ICU care.
Somebody has asked a question that is there any, somebody asked a question I just read, that is there any number in case of emergency where people can contact? Yes, NCDC toll-free number is there, 24/7 NCDC lines are open, which are connected directly to IDH Yaba for emergency response. And there is an emergency ambulance evacuation team is also available by Lagos State Government, where people can contact. And I don't know much about Abuja, but in Lagos, yes, lines are available, contact numbers are available.
Yeah, I just wanted to add for Indo-Eye care facilities, as Chief Grover has mentioned, we are having a contact number for facilitation. Anybody is having the COVID, having positive certificates, they can contact Mr. Paul Singh Saab, Mr. Anupam Ghoshal, and Madam Elvin. There are 3 persons in that coordinations with the doctors for admissions. Again, for ambulances, anybody can call Chief Grover Saab, and also there are 3 to 4 numbers in that ambulance services. For food services also, they can call Mr. Sabir Ali and also the HSS team, so that all the things are being provided at free of cost to everybody. So please contact those numbers at any point of time, 24/7, everybody reply to you. Thank you.
I think there's no more questions. Is it then? Shall we round up?
No, there are 2 more questions. Chat में है, आप थोड़ा देख लीजिए.
Sanapati ji wrote a question here. Good evening, people who are working in frontline and close contact is detected by the virus. Do we need to check others or will observe for symptoms? Chief Grover?
Can Senapati ji speak and just elaborate?
Yeah.
I have not understood. What does he want to know? Can he speak? If he can unmute his mic.
Yeah, good evening.
Okay, good evening.
Sir.
Please
Yeah,
go ahead, ask your question.
Yeah, suppose people are working in a group and somebody is detected by the virus. So do we need to check the others, or we will wait for their symptoms?
Means if in a family, if somebody is positive, you want to know what about the status of other family members?
Family or in a working place, like in a factory where 50, 100 people are there working, and maybe 1 or 2 person are detected by this COVID. So what we will do for the others? We cannot check maybe 50 or 100%. So what we will do in that case?
Okay, Dr. Tope, over to you.
Yeah. In addition to that, there is also the similar type of question from Madam Rena Samudra. If no symptoms, I think no need to test. Sometimes happens like that, COVID positive, but no symptoms. I think these are the same questions. Doctor can reply at a time.
Okay, sir. Well, if there are no symptoms and we have quite a number of people, the issue is resource and having access to the resources or the money to pay for so many tests. So in such a case, what we would advise is for all the people to, one, if either they self-isolate, but then if it's a business or a workplace that you cannot shut down business, they need to ensure that, one, they're using the face mask, face shield, and then distancing as much as possible they practice while watching out for symptoms. But then the very close contacts to that particular person, we can try and identify the very close contacts. So maybe those that work with him in a particular shift or in his own particular space, such people can be given priority of carrying out the test, while others are observed for tests for symptoms, and then everyone is either isolating or using the face mask, face shield, and maintaining a distance. So as symptoms develop, as he said, and Dr. Grover said, if symptoms develop because there has been an history of contact, they should have the test done so as to rule out COVID or not. That might be the best way to address it. But if it's just one or two that had contact and there are resources to do the test, they can actually go ahead and do the test if there are resources.
So, Senapati ji, the thumb rule by Johns Hopkins as well as NCDC or ICMR guideline says, you wait for 5 days. If there is no symptom, then within those 5 days, after 5 days, you can do the test. But you can wait up to 5 days if you are in contact with the positive case.
Thank you very much.
Exactly.
Thank you.
Usually, after the getting the virus into the body, it has a gestation period from clinical infective stage to reach the infective stage. So that period is 5 to 7 days window. So if somebody will get infected and start showing symptom, it will happen within 5-7 days. So up to 5 days, if there is no symptom, otherwise after 5 days, you can go for screening swab PCR test.
Exactly, sir.
Thank you. Any more questions, ladies and gentlemen?
I don't think there is any question, sir. You can go to the next agenda, sir.
So the next agenda is, thank you so much, Chief Grover, and thank you so much, Dr. Gunia, for your wonderful presentation. And we are sure this is really going to help all of us here. And over to you, Praveenji or Meshi.
Yeah, I'll request Pravinji to give a formal vote of thanks to everybody and especially to our guest speakers and also the participants, whoever has come. Yes, we have got very less participants, but it is always the participants who have come, 30 to 35 participants. They will get to double. Thank you.
Thank you, Ramesh ji. Yeah. Yeah. So thank you, Ramesh ji, and everybody, all protocol observed. I would like to say thanks to Dr. Tope.
प्रवीण जी आपका म्यूट हो गया है. प्रवीण जी, you are mute.
I think he has been disconnected.
तो बिजवाल जी आप कर दीजिए.
Okay. So thank you. Thank you, Dr. Tope, for giving your time, and we really appreciate. and the informative informations. And also our special thanks to the Chief Grover. As usual, he always dedicated his services and also the speech, very nice and informative. So we are thankful to both the guest speakers, and we are special thanks to all Samaj presidents and all Samaj participants. And we are thankful to all our mentors, and also we are thankful to our all those Samaj presidents and also our working committee members, especially to Paul Singh Saab, and with whose support we have got this second wave, second opening has been done quickly. Thank you, Paul Saab, and also all working committee members. And I thank Pravinji and also other working committee members, Chief Grover, Mr. Kamatji, Dinkarji, Tarunji, and Sabir Saab. So really it is very support and good actions SABHA is taking. I thankful to everybody and to all participants. So we request everybody to join as and when the forum is coming. So it is always informative to stay safe. It will help us. So thank you all once again. Praveen ji, aap aa gaya? You want to add any more things, you can add, please, because you have got caught. That's why just Chief has told me to complete that things, but you can add anything.
I think it's still.
Sorry, there is some technical problem in my internet, so I could not join in time. And thank you, Ramesh ji, for the vote of thanks.
No problem. Thank you.
On my behalf and Sabha's behalf.
Thank you.
Thank you, ji.
Thank you. Thank you, Doctor. Thank you.
So next webinar most probably on the 18th, and it will be the all religious prayer meeting.
Thank you, ji.
Very good.
Sure.
We need prayers.
So flyer and information
really
will be
need
published
prayers
very soon
in this country
for the wide circulation. Okay.
Yeah.
Yes.
But we request all Samaj presidents and whoever is present here, please tell your
सर्वधर्म प्रार्थना
Samaj.
सभा उन्होंने फर्स्ट वीक में किया, बाद जो है कोविड खत्म सी हो गई. Yeah.
No, I was just saying, let whoever is present here, you are representing one particular Samaj, please convey that, so that from each Samaj, if you come 10 to 15 members, we will have so many people, at least such a.
Sir, unmute yourself, please. Ramesh ji, unmute yourself.
Okay, I don't know how it is happening. No, I was just requesting everybody to join this type of when doctors are coming, let every Samaj post the things inside their group so that many people can come and join. And whoever are presidents.
Yeah, because you know, today there is a lot of sorrow and pain and something. So a lot of people are busy and engaged for those unfortunate demises of our members and members. So, and today is the working day also. So that is the cause of the less participants here.
Yeah.
Whoever is the participant, I think 35 participants are here and they have joined the webinar. This is enough, and this 35 will circulate their messages, whatever we have discussed here, and we have advised to the, and our panelist doctors has advised to the society. That will be also a good good practice for the community. Secondly, our webinar, all webinars including this webinar, is also available on the YouTube. So anytime people can visit Sanyukt Bhartiya Association YouTube, and they can see this
Can we
program
share the link with the
same
public?
like
Praveen ji,
yeah
is it
link
possible to
if
share
you
the link?
sir
हाँ वो करा
yeah
देंगे
sir the barcode what is called barcode or some QR code is always available our all the flyer, the QR code is there for the YouTube live, and this QR code is always working forever. Even though the recorded program from the first webinar to today is the 21st webinar, everything is available there. If people want to visit there, they can get the benefit even the offline. When our webinar is so informative and so important for this time. So I requested all the members present here, they can just convey this message to their own society members, own friends, well-wisher, and everybody to just watch that video. If they are not participating in the webinar for any cause, they can visit there, and it is available publicly. It is not restricted. So today webinar is already recorded on the YouTube. So it is not nobody is loser that who are not available for the webinar. They are also benefited. They also benefited for this if they are going to visit our YouTube. And if people go there and subscribe them, automatically this notification will go there in their mobile, and they can watch that. What is happening, new happening? What is this? Only to go subscribe this and push the bell button.
Yeah.
If you do like that, you can get the webinar recording automatically in your mobile or in your social media platform. Your mobile, your laptop, and your YouTube.
Yeah.
So this type of arrangement SABHA has done for the people, because this organization is for the people and by the people, not for any individual or anybody. We are just working for the society, and society can benefit it any time for the webinar. So
ग्रोवर साहब हम लिंक शेयर कर लेंगे. We'll just share the link. Thank you.
Link share कर देते हैं so that all the Samaj presidents can forward it to their community.
Yes, we'll do that. We'll do that. Shiv Kumar ji, namaskar. Thank you, sir, for attending for a long time. Mohesh ji, thank you, ji. Prakash sahab, namaskar. Thank you, sir. Sanapati sahab, thank you. Himanshu ji, namaskar.
Thank you, sir.
Thank you. Thank you.
Thank you, everyone. Thank you.
Thank you. Thank you. Satya Babu, namaskar. Bhavani ji, thank you.
Thank you, Baina. Thank you.
Thank you. Thank you. Santruta, thank you for joining. Good.
Today evening we lost one more Indian. Today evening.
Yeah, that is what you have posted, but it is 33 years, sir.
33 years, young boy. 33 years.
Company?
It's really, really sad.
Sir, from
He has
which
his own
company?
business.
Oh God. It is.
But he was under treatment in Vedic for a long time. I think more than a
He
week.
was there for a long time, but his recovery was very poor. Viral load was very high. He developed some complications yesterday.
नहीं ठीक है दही दही भी दे ज्यादा दही मत दे उस दिन जितना दी उसका आधा दे.
So unfortunate day for today, sir. Unfortunate. Continuously for the 3 days, 2 days, it is happening like that. क्या करें?
Yeah.
In case of Nanduji, it was a clear denial and delay by the family.
Yeah, that's understandable. That's understandable. But for this one, for Mr. Khatri, really is very, very.
Yeah.
He was under treatment and he was young, So
He had some complications. Yesterday his condition worsened.
नहीं अभी मैं क्या सोच रहा था जस्ट चीफ ग्रोवर आई डोंट नो पॉल साहब भी ये क्या बोलता है अभी रात को जैसे कोई बोलते हैं ना कि हम रात को लेके आते हैं एंड वो बोलते हैं कि नहीं कल सवेरे तक हम लेके आएंगे आई थिंक इन दैट नाइट ऑल्सो वी शुड ट्रांसफर दोज पेशेंट्स एक्चुअली में अभी 3 केस हो गया है जैसे कि एक डॉक्टर सलामी रात को 12 बजे तक बोलेगी अरे कहाँ पे आईसीयू देखो वी हैव searched for it, we could not get it. Around 12:30 we got the ICU.
In Ikeja.
We could got it Palian, but by the time we have said yes, we are sending it, they have said okay, you can bring it. But the people they have said okay, we will wait up to the morning. By the time morning means 5 o'clock, he collapsed.
Yes.
So
I was in touch with Dr. Salami.
I'm suggesting that okay, let's have that anytime this type of cases, let's transfer them immediately. You strongly advise them, please do it immediate. Not
yeah, I think in Indo Eye Care, can they admit like 24 hours anytime? We need to confirm this with
yes, they can.
Okay.
Dr. Ogunia has told anytime you can come.
Okay, great.
But let's reconfirm again. Let's reconfirm.
But we will reconfirm.
You will do
today,
that tomorrow morning. You can do that.
Yeah. Today we have already 4 patients who have confirmed that they have to go there, and they are going there tomorrow morning.
4 of them.
4 of them, yes. 4 Indians.
अभी इंडियंस में तो बिल्कुल आग की तरह फैल रहा है, जंगल की वाइल्ड फायर की तरह इंडियंस में फैल गया है.
Yes.
Everywhere, sir. I'm saying there is home quarantine. As far as I know, I can give you 35 numbers.
Sir, it is also in Nigerians. Only thing we will not know when it happens in that community. We only know our community, but I think it is in all the communities.
Yeah.
Sad, very sad.
नहीं बहुत अभी खराब हो रहे हैं सर. It is the not only that ये weekend थोड़ा सा संभाल जाए, because if you know that for those 3 days with
yesterday,
the weekend and Monday,
when Nanduji died yesterday, his son refused to accept. He went into hysteria. He said, no, I cannot accept. My father is only unconscious. He challenged the medical doctor and the nurses. He forced them, you take me to Yaba. I want to go to Yaba. I want to go to Luth. I will not believe it. He forced everybody and took the ambulance and doctors and nurses to Yaba with him around 10 o'clock. They rechecked him in Yaba in the night and they declared him dead. Then he refused to sign the papers to admit him in the mortuary. Oh, it lasted almost up to 11:30 night. Then ambulance and my night staff came back after around 12 in the night.
Yeah, I have seen that, Chief.
Yeah, being critical.
Yeah, those staffs, they are doing a great job actually.
Yeah,
they have the timing and all this.
No doubt, sir.
बिहाय करते हैं तो सोचते पॉसिबल नहीं है, मेरे साथ ऐसा कैसा हो सकता है, नॉर्मल फ्लू है.
Yeah, it was very difficult for the young boy to accept the reality. He refused. He said, no, my father cannot die. He's not dead. He refused.
Yeah.
He works in Dana. वो डाना ग्रुप में काम करता है, तो बड़ा मुश्किल हुआ रात को उनको समझाने में, रात को almost. Then the Gita Ashram trustees, they had to call him and they said, please accept the body and sign the papers.
क्या करें? These are the things. We don't have.
Okay, Biswalji. I'll take your leave, sir.
Okay, right, sir. Let's close the meeting now.
Okay, Paulji. Thank you, Paul.
Okay, sir. Thank you so much. Thank you for your wonderful presentation.
7 o'clock थोड़ा कल जगाएंगे सवेरे.
हाँ जी, no problem, sir. We will meet tomorrow morning.
थोड़ा 7:30 रखो सर, 7 बजे बहुत अर्ली हो जाता है.
कल सैटरडे है, ठीक है, 8 बजे कर देते, नहीं तो आज मैं पोस्ट कर दूंगा 8 बजे.
हम एक्चुअली 7 बजे तो उठते हैं, 7 सवा 7 बजे तो.
ठीक है, 8 बजे कर देंगे कल.
और आप मीटिंग तब करते हो जब टॉयलेट में होते हैं, वीडियो भी नहीं ऑन कर सकते.
ठीक है सर, 8 बजे करेंगे.
ठीक है सर, ठीक है. Okay.
Okay, sir. I am closing the meeting with the due permission of everyone.
थैंक यू. शिव कुमार जी कुछ बोलना चाहते हैं? महेश जी कुछ नहीं बोल रहे हो? एनीबॉडी वांटेड टू टॉक एनीथिंग? शिव कुमार जी, बेलापन साहब, महेश जी, हिमांशु जी, रामकृष्ण भाई ना, यू वांट टू टॉक एनीथिंग? साबिर साहब कुछ बोलना चाहते हो?
Thank you, sir. Thank you very much. It's a very nice meeting. Everybody get aware of this. I
Thank
really
you,
like
sir.
it, but sometimes we are not able to participate due to some time constraint. But thank God that people are knowing that everything, people should know that, and people should aware about that. Ki what is going on, the recent things, what is happening, the day-to-day activities is very critical. It's
Yeah,
very,
yeah.
very critical. And we all should take precaution for that. And we should aware everybody that, okay, put your masks, even though your friend, even your brother, even though everybody, we should to keep talking to them, whether you like it or not like it.
Yeah, yeah.
We should keep talking. Thank you very much, sir.
Thank you, thank you, thank you.
Yes, sir. Thank you, everybody, sir. Thank you.
Thank you, thank you. प्रवीण जी तब बंद करो। ये कहाँ शिव कुमार जी नहीं आ रहे हैं?
शिव कुमार जी तो हैं यहाँ पे, मैं फोन करता हूँ उनको।
महेश जी, महेश जी,
महेश जी नहीं है, लग रहे हैं।
नहीं है ना महेश?
हाँ है, वो अनम्यूट कर नहीं रहे, उसका रेड बटन दिखा रहा है वो।
वो महेश जी करके वो वॉक कर रहे होंगे, अभी उनका वॉक करने का टाइम है ये। सत्य भाई, कैन यू टॉक एनीथिंग? संतृप्त बाबू, दिव्यांशु बाबू, त्रिपाठी भाई ना, यू कैन टॉक इफ यू वांट, प्लीज।
Thanks a lot. Great information we got. It's an awareness program. We are blessed that we have such a great team. They are enlightening on all this information time to time and helping. It's a great job. Thank you, and thank you all.
Thank you, thank you. शिव कुमार जी नहीं आएंगे शायद, इज समवेयर बिजी। आप बंद कर दो तो अभी। ठीक है सर, एवरीबॉडी थैंक यू, वी आर रियली ग्रेटफुल टू एवरीबॉडी।